Uganda has the third highest number of malaria cases after Nigeria and the Democratic Republic of Congo, and with the 8th highest malaria deaths. Every day, 16 people die due to malaria, 10 of whom are children under 5. To reduce the malaria cases, early this year in April, Uganda distributed 2,278,000 doses of the RT1 malaria vaccine. The doses procured by government and Gavi were targeting children aged 6 to 18 months in 105 high-burden malaria districts in Uganda, which were chosen based on severity. Despite the massive sensitization among the target population, Dr. Lugemwa, the head of Malaria Control at the Health Ministry, said the turn-up is worryingly low.
When we started off, we almost scored 80% of the targeted population at that time. That was around April. And second dose should have been around May for those who got their dose in April. And second dose, as we talk now, was around 60% nationally. And then third dose, unfortunately, is coming down lower than we should have expected, because having started with 80%, we should have maintained 80% continuously. But we seem to be plummeting to lower levels, which is very unfortunate.
Dr. Lugemwa says the induction of the vaccine was to prevent the effects of severe malaria, especially among younger children.
The cost of this vaccine and its value, its efficacy, and why it was put into part of the routine vaccines, having taken 50 years to discover, was to prevent the serious forms of severe malaria, like severe anemia, severe the convulsions, the kidney failures, that, and even loss of limbs that go with the severe malaria.
He says this puts the health ministry in jeopardy following the amount of money spent to acquire the vaccine.
But apparently, the plummeting percentages are really hurting us as a ministry, as a country, where a vaccine, which costs a lot of money, between $2 to $4 per dose, is being not put to waste, but people are not partaking of this dose, which was meant to really prevent the severe forms and save our children, as it were.
He urged the communities to follow other interventions of controlling malaria despite the malaria vaccine, citing the trickiness of the vector.
As government, we do indoor-reduced spraying, especially where malaria is very, very prevalent, like in West Nile. Recently, West Nile was the second contributor of malaria burden in this country, next to Karamoja. But because the houses in Karamoja cannot easily be sprayed, we went in for West Nile and we sprayed. And as I told you, after 6 months of spray, malaria has plummeted. This does not mean that you don't use other methods. When you fall sick, you should go to the facility, because removing the mosquito may not mean that your parasites have been removed. So you also need to have the parasites treated if you feel any symptoms of fever or malaria-associated symptoms, as it were.
Uganda is the 19th country in the world to introduce the malaria vaccine and is undertaking the largest rollout globally. Maria Jacinta Kanyange, NTV.